Consumer Reports and Consumer Reports Health presents Healthcare, Making Healthy Choices.
Hi, I'm Orly Avitzer, Consumer Reports medical advisor and a practicing physician. When I see patients, I often spend time talking with them about the importance of making informed choices about any medical treatments or tests they might be considering. In those discussions, I advise my patients that it's just as important to avoid overtreatment as it is to get the right treatment. For example, when I have a patient with low back pain, I don't usually recommend an MRI or any other imaging tests right away, but rather encourage my patient to remain active and avoid bed rest. This is because imaging tests have risks, can cost a lot, and can lead to surgery that may not be needed. My opinion on this and about many more overly used medical tests and treatments are backed up by the Choosing Wisely campaign, a national campaign that Consumer Reports is part of, along with over almost 500,000 doctors. The video you're about to see tells you more about why it's so important to talk with your doctor and ask questions about any medical tests, treatments, or procedures you're considering.
How we access healthcare, how we see quality, and how we pay for care, this is all changing in the dynamic healthcare system. There are now more options and more decisions consumers have to make about their own healthcare than ever before. To be able to make good decisions for yourself and your family, you need credible information and guidance about the quality and cost of healthcare. Consumer Reports has been a trusted, independent, unbiased voice in healthcare since their very first magazine in 1936. They, in cooperation with your employer, have created this presentation to help you make informed, quality decisions about your own healthcare. When it comes to cars, consumers often believe a more expensive model is better. With TVs, to get the most advanced model you want, consumers often expect we're going to have to pay more. And in healthcare, many of us believe the more care we get and the more money it costs, the better the results. Not exactly. Our health is not like a car or a television. In healthcare, more is not always better. Too much treatment can be unhelpful, and it can be dangerous. Let's say your child bumps her head. You are concerned there may be something wrong, even though your child shows no symptoms. You think you should get a CT scan to make sure. In this case, if your doctor does not find any worrisome signs, the best course of action may be to carefully watch your child. Why? Because a CT scan exposes your body to radiation and is not worth the risk when your doctor sees no signs of trouble. Plus, there's the possibility you can get what's called a false positive result, which can lead you down a path of more tests, treatments, even surgeries that you may not need. Much of the time, if non-invasive approaches are used, you will get better with time. Experts agree that 30% of healthcare is wasteful. We're getting lots of tests and treatments we don't need, and not getting some we do. So, before you agree to a test or treatment for yourself or a family member, ask your doctor about the risks, benefits, and options, and choose wisely about whether you want to proceed or not. This not only keeps you healthy, but saves you money. So how do you choose wisely? How do you know which tests and procedures are essential and which might cost you money with no medical benefit and possible harmful results? The key is to talk openly with your care provider and ask them specific questions when they recommend a test or treatment. Questions like, what are the risks? Are there any other options? And what happens if I don't do anything? Some treatments are not only unnecessary, but can be dangerous. In some cases, treatments such as sleeping pills, drugs for weight loss, opiates for headache, and others have side effects that are much worse than the benefits they offer. One example of an unnecessary treatment, antibiotics for viral infections, like the common cold. Antibiotics can be powerful, even life-saving drugs for serious infections. But for viral infections, they do nothing. They do not treat viral infections like cold, flu, pink eye, ear infections, and sinusitis. Viral infections normally clear up on their own in just a few days. Yet antibiotics are commonly prescribed and can have side effects such as diarrhea and rashes, even death. And overuse of antibiotics can make treating future infections more difficult by leading to the development of resistant bacteria or superbugs. There are over 140,000 emergency room visits for reactions to antibiotics every year. So, before your doctor prescribes you antibiotics or any other treatment, ask questions and choose wisely. A powerful tool that can help you choose medications that are proven to work well and are cost-effective is Best Buy Drugs. You will find links to resources by Best Buy Drugs at the end of this presentation. Also, you will find links to the Choosing Wisely campaign, which is an initiative that identifies unnecessary tests and treatments. In addition to asking questions about getting too much care, you should also ask about not getting enough care. Certain tests are often overlooked or underused. Vaccinations and tests for high blood pressure, high cholesterol, diabetes, and certain cancer tests at the right age and frequency, including colon, breast, and cervical, are recommended and can save lives. People with chronic problems like diabetes, heart disease, and arthritis can especially benefit. At the end of this presentation, Consumer Reports will provide essential links to tests you should be taking, when you should take them, and those you could easily avoid. Even though there are certain tests and treatments that you do need and that are important to get, remember, there are still a lot of tests that we, as healthcare consumers, ask for but don't always need. Sometimes these are things we've heard about from our friends and relatives or from advertising on television, magazines, or billboards. Bone density tests, stress tests, allergy tests, and body scans are all tests that are overprescribed. And all these tests carry risks, from unnecessary exposure to radiation to the potential for false positive results that can lead to more aggressive, potentially harmful tests and treatments. Each year, new medical devices and procedures are introduced and incorporated into healthcare. The latest and greatest often cost more and are sometimes better, but not always. For example, many in the baby boom generation had their tonsils removed. But was it necessary? Not in all cases. Often, hospitals require chest x-rays before routine surgeries, but they usually aren't necessary unless you have lung or heart disease or signs or symptoms of a heart or lung condition. Doctors offer EKGs in their annual exam. While they may be indicated for some patients, often they are done without any specific purpose in mind. In healthcare, just because we have the technology doesn't mean we must use it. When it comes to having a baby, modern medicine can supply a lot of bells and whistles. Sometimes it is medically necessary for a doctor to induce an early delivery or perform a C-section, but in most cases, these high-tech procedures are unnecessary and potentially harmful to both the baby and the mother. Babies delivered before 39 weeks of development have a higher rate of breathing and feeding problems. So, it's important for the baby's and the mother's health not to induce labor early unless it's medically necessary. C-sections have all the risks and recuperation time of major surgeries and make it less likely for the mother to have immediate contact with their new baby. For birthing practices, as with many other medical treatments, most of the time it's a healthier alternative to avoid the high-tech option and let nature take its course. So, in making your own decisions about healthcare in this increasingly complex healthcare world, it's healthy to question the tests and treatments you've been recommended and to think twice about the ones you request. Make sure you're comfortable figuring out with your doctor what treatment plan works for you. To help, Consumer Reports offers lots of information and resources in both English and Spanish. Information and guidance endorsed by many doctor groups, all free. Go to this website to help you make healthy choices.